Hospitals in New York are swamped with COVID-19 cases. The president's team says cities all across the nation had better get ready for the same surge. But there is hope. New treatments seem to be making a difference. Dr. David Perlmutter is a neurologist and best-selling author, and he joins us now to talk about the spread of that virus. Doctor, it's so nice to have you back with us again.
Pat, always great to see you. Thanks for having me.
Are there any new drugs? They're talking about this hydroxy, it's a quinine kind of drug that they use to treat malaria. Is there any suggestion that that might be effective?
As a matter of fact, there is. There have been a couple of studies that have recently come out. One, in fact, published just yesterday. This was a combination of the malaria drug, hydroxychloroquine, along with azithromycin, which is a fairly common antibiotic people may take when they have bronchitis or pneumonia. And in fact, the results, it was a very small study, only 20 participants, but it looked at how long, or rather how many of the people taking the drugs were virus-free at day 6. And they found that 100% of those who took both drugs were virus-free at day 6, whereas the people who were just taking the hydroxychloroquine, about 57% were virus-free, and about 12.5% who took neither drug were virus-free. So it looks very, very impressive. A lot more studies are being done now. The issue always, Pat, when we look at a treatment of one form or another, is what we call the risk-benefit ratio. And that means what are the risks involved in a particular treatment versus the benefit. It looks like the benefits are pretty profound. This is an early preliminary study, but are there risks? And indeed there are. We do see that with hydroxychloroquine, the anti-malarial drug, that there are some people who develop rhythm disturbances of their heart, which sometimes can be quite significant. So we're going to need to watch that and remember that we have to consider that we don't want to do harm. Beyond that, there are a cadre of antiviral medications that are getting a lot of attention. And I think the most popular one right now is one called remdesivir, made by a company called Gilead. And this looks actually very promising. According to the World Health Organization, the most promising drug out there. And indeed, just yesterday, women and Brigham and Women's Hospital in Massachusetts indicated that they have the go-ahead to study this. It's been used for what we call compassionate use, which means when there's nothing else that can help turn a patient around. Giving this intravenous medication, remdesivir, has proven really quite dramatic in a very small number of patients. Now we're going to see remdesivir used not just in compassionate use, when people are really in extremis, but also in what's called extended access. So it's going to be used quite more aggressively in terms of much larger populations. This was a drug that was originally developed during the Ebola outbreak and is now basically being repurposed. But, we've got a lot of hope for that medication as well.
You have been famous for your talk about the gut flora and the immune system of the human being. Is that a significant factor? I mean, is our immune system going to help us resist this thing or at least recover quickly from an onslaught of coronavirus?
Absolutely. What we just finished talking about is offense. Medications are playing offense, which really right now we don't have much of. And it's been said that the best defense is a good offense. The offense hasn't shown up to play the game yet, really, but we need to work on our defense. We need to work on our immune systems. And as you have pointed out, not just now, but in many of our conversations, that the gut bacteria play a fundamental role in regulating our immunity. So, when we look at the prevalence of COVID-19 in places like Haiti and sub-Saharan Africa, where they are not as hygienically concerned as we are in more developed countries, they seem to be doing better than are we. And it might well be that because of their lack of hygiene, they have a more robust microbiome, a more diverse microbiome, and are more equipped from the gut bacteria perspective to deal with this challenge. We know that the underlying conditions that people may suffer, like coronary artery disease, diabetes, and obesity, are clearly associated with worse outcomes. And those are situations that are far more common in our developed world based upon the foods that we are eating.
Let me ask you something else. The Chinese are saying everybody should wear a mask, that they all should. And the CDC just put out some guidelines moments ago that indicates it may be something they're suggesting for Americans. What do you think about the concept of everybody wearing a mask?
Well, first, let me say that it's an indication that our response is very dynamic, that things change day by day. You know, we were hearing that perhaps the economy would get back up by Easter, but now the president, rightfully so, has indicated that we may need to be restricting our movements for a longer period of time. So what you're seeing is this wonderful dynamism where we are changing our messaging as we see things develop. And, you know, the original messaging here in the United States was to not wear masks. And I think part of that messaging was because we recognized early on that if everybody was to get a mask, that might create or exacerbate the shortage for healthcare practitioners. I think that there is value in wearing a mask. Will it necessarily screen out all of the COVID-19 virus from you being able to breathe it? Not necessarily, but one thing a mask will do is keep you from touching your face. When your hands are contaminated, which when you're out in public is likely to happen, the risk of you touching your nose or mouth is markedly reduced if you're wearing a mask. I happen to be in favor of it. When we look at those countries that have so-called flattened the curve, countries like China and South Korea, not only are they practicing social distancing, but they're generally wearing masks. I think we have to learn from that experience. So I'm in favor of it, provided it doesn't create a shortfall for healthcare practitioners.
One last question. Do you think that curve is going to flatten out pretty soon, or do you have any prognostication about how far this thing's going to go?
Well, we've heard in a couple of weeks, with all due respect, I think it's a bit of wishful thinking. Much of the data indicates middle of June that we will reach our peak. The slope of the curve right now in terms of increasing numbers of people infected and numbers of people who are dying is really almost straight up. The way to make this happen is by changing our behavior. You know, when Deborah Birx, the White House spokesperson for coronavirus, coordinating the effort, indicated yesterday and the day before yesterday that we should expect 100,000 to 200,000 Americans to die. The part that people need to hear loud and clear is she indicated that is if we do everything perfectly. Well, you know, we're not necessarily doing everything perfectly. We are human after all, and I think the numbers may well be significantly higher than that. It's been indicated that the number of Americans who are going to get infected with coronavirus ranges between, on the low side, 40% of all Americans, and on the high side, 80%. We are a country of 330 million people. To be conservative, let's say 50%. That means about 170 million Americans are going to experience this infection. Now, the death rate seems to be coming down as we learn more about these so-called asymptomatic people. So the overall death rate might be somewhere in the neighborhood of 1%. That's still about 10 times what we typically see for the seasonal flu. So if it's even 0.1%, we would expect at least 1 million people to die from this current experience. We know what works. We know what works right now, and that is efforts to isolate people away from each other. Is that going to have economic impact? Absolutely. But the sooner we move through this and do the right things now, the better chance we have at picking our lives back up and resuming business, et cetera. So, it's been said that halfway measures work halfway. We've got to really be all in. And this idea of distancing ourselves from other people in an urban environment and even in a rural environment, I think is fundamentally important.
Doctor, you've got the most insightful analyst I know anything about. Thank you so much for being with us. God bless you.
Thank you, Pat. Thank you for having me.